If it's October, it's Breast Cancer Awareness Month. Hi guys, Dr. Rachel Winstead here, naturopathic physician, practicing functional integrative medicine in Washington State. I just wanted to take a few moments to explain the updated mammogram screening recommendations to help you figure out if you are due for a mammogram and how often you should get them, where to go to figure out if you have an average risk of developing breast cancer or a high risk of developing breast cancer, because those recommendations for screening are very different depending on your risk, and also to answer the question, should guys get mammograms? So the new recommendations for screening mammograms were released in the spring of 2024. They were released by the U.S. Preventive Services Task Force, which is an independent volunteer panel of national experts on disease prevention and evidence-based medicine. Their job was to look at the data and make decisions about whether to keep the screening recommendations for breast cancer the same or how to change them to better prevent disease, and it's all based on evidence-based recommendations from the data. Just the data is what drives this, keeping in mind that they're trying to prevent disease and serve everyone as much as possible to the ends of them having a happy and healthy life, but also to keep in mind and weigh that recommendation change against the possible increase false positives and the emotional and financial burden that having to do additional testing could cause for a false positive. So the updated recommendations for mammograms is that women starting at the age of 40 years until they are 74 years of age should get mammograms every 2 years. What that means is you should get a mammogram, which is a type of screening tool that is a low-dose X-ray that takes sensitive tissue, the breast tissue, and puts it between two cold, I'll just admit it, cold X-ray sides, and they look at the breast tissue for signs of cancer. This works well for many women, many types of breast tissue, but there are some types of breast tissue that are dense or have fibrous tissue or have lots of calcifications, which may require additional testing or other forms of testing. And that is something that you will be told if your screening mammogram has any sort of unclear results. So this recommendation is a change. Previously, we recommended that female patients starting at the age of 50 years go in for screening mammograms, and as you can tell, a whole decade earlier is now what they recommend. To figure out if you have the average risk of developing breast cancer, which this recommendation is for, go and Google National Institutes of Cancer Breast Cancer Risk Tool, or go to the website that I've highlighted here on the bottom of this page. So bcrisktool.cancer.gov/calculator.html. And I just want to say it's not comfortable to get a mammogram, but it is quick, and peace of mind for 2 years is worth it, in my clinical and not so humble opinion. The changes were made to screening because more women were getting breast cancer in their 40s. When we look out a decade, at the age of 30, you've got less than a 0.1% chance of developing breast cancer, or a 1 woman in 204 will develop breast cancer. At the age of 40, that risk of developing breast cancer jumps to 1 in 65. So it went from 1 in 204 to 1 in 65 women. Then by the age of 50, 1 in 42 women will develop breast cancer, and by the age of 60, 1 in 28 women will develop breast cancer. And this is over the next 10 years. So essentially, the risk of developing breast cancer, the task force found, was significantly higher for women in their 40s. And because women in their 40s were getting cancer, the goal is to catch it earlier when it's easier to treat and more survivable. And that's why the recommendation was changed. In fact, by starting to screen at 40, what was discovered is that they were able to reduce death from breast cancer by 20%. So even if you got breast cancer, it was caught earlier, and 20% more women survived breast cancer, which is so awesome. I also want to say that cancer caught earlier, it's easier to treat. It's had less of a chance to metastasize, and that's really what we want. We want to catch it before it spreads. And by screening earlier, we're finding cancer in women of color, which Black women are 40% more likely to die of breast cancer compared to their white counterparts. And statistically, Black women get more aggressive forms of breast cancer, and they get it earlier. I don't know why, it's just that's what the data shows. And by screening earlier, we're catching more Black women and also women of certain ethnic backgrounds, Ashkenazi Jewish women or women with that heritage do get breast cancer, aggressive forms of breast cancer, and get it earlier than previously thought. So we're catching more of these cancer cases by starting to screen a decade earlier than previously recommended. So you might wonder if it's safe to get mammograms because it's a low dose of X-ray. Why shouldn't I get screened every year? And absolutely, you could go in for screening every year. The U.S. Preventive Services Task Force is not opposed to you opting to get more frequent screenings than the every other year they recommend, but you don't have to. Looking at the data, it seems that every 2 years is the right interval for most people with average risk of developing breast cancer to get screened, to catch it early, and to catch it at a treatable stage. Other reasons why you might have more frequent screenings are your own personal risk factors, either genetics, family history, personal environmental exposures, such as if you've had radiation to the chest before the age of 30, that increases your risk of developing breast cancer. Other reasons, it could even just be as simple as your clinic's policy is to screen at a different interval more frequently than every other year. That's a conversation to have with your provider, though. So there are other groups other than that task force I've mentioned that are making recommendations around mammogram screenings. One group is the American College of Radiology. This group recommends that all women, especially women of color, Black women, and also women of Ashkenazi Jewish descent, be evaluated by the time they hit their mid-20s for their risk of developing breast cancer. And again, go to that website I mentioned earlier to get your risk status. So average risk or high risk. It just takes minutes to do, literally minutes, and you will have an idea of your risk history or risk factor for developing breast cancer. But again, other recommendations are out there, and the recommendations are based on a variety of factors. So women at higher risk of developing breast cancer, they may have genetics that make them more likely to develop breast cancer. There's gene mutations for the BRCA1 and BRCA2 genes. That's BCRA1, BCRA2, that have been identified as risk factors for developing aggressive breast cancer. A person might have a parent, a sibling, a child who has breast cancer or has that gene mutation. Maybe you've had radiation treatments to your chest prior to the age of 30. And certain health conditions predispose someone to developing breast cancer. Certain health conditions, which I won't name here, there's just relevant to our discussion. And a woman who has a high risk of developing breast cancer, that means essentially there's about a 20 to 25% greater chance of developing breast cancer than someone with average risk. And the tools that are used to assess this are primarily based on family history. And if you do have a higher risk of developing breast cancer, additional screening to check for cancer may include 3D mammograms, ultrasound, or an MRI. The interval is up to your provider's recommendations and your personal risk. So I promise to answer this question. Should men get mammograms? And the answer is maybe. Most men do not need to get a screening mammogram. Men do have breast tissue, but it's a very small amount of breast tissue. And for most cisgendered men, regular screening mammograms are not recommended. However, there are categories of men who have higher risk for developing breast cancer. Men with certain genetics that we've talked about, men that have strong family history of breast cancer, other risk factors like that radiation to the chest before the age of 30, all will increase risk of developing breast cancer. And in these situations, it may be appropriate to have screening for breast cancer at a regular interval, whether it's every 2 years, every year, some other interval. That's up to the male patient, the cisgendered male patient, and their provider to decide.